A very good morning to you, my dear viewer, from wherever you're watching us from. This is Elevate TV, the Morning Digest, a show that comes to you every Thursday morning from the Elevate TV live studios. And today we are going to be talking about nursing, a caring profession. And in the studio today, we have a guest. She's a medical practitioner, and she's going to be telling us more about herself. And before she introduces herself, the whole profession of being a nurse is probably something that many people have made assumptions about, they have myths about, and today we're going to delve deep into understanding what is all this about nursing, and especially the role that nurses play in the medical profession. And so let's welcome to the show Dr. Christine Musee, nurse. Karibu sana to the show.
Thank you very much, Madam Anne.
Yes.
Thank you for having me.
Yes.
Hello, everyone.
Welcome so much to the show.
Thank you.
Would you like to introduce yourself and tell us a bit about what your day in your life is like in terms of dealing with human lives?
I'm Christine Musee, as already said. I'm a nurse, and currently I'm working in a hospital setup. I'm bringing this out because many nurses work in different setups. I'm in a hospital setup, and currently I'm in the management level.
All right.
So my day in the hospital starts at 7:30 in the morning.
Yeah.
We normally are able to tell when your day starts most of the time, but you're not able to tell when your day will end.
Okay.
But officially it ends at 4:30.
Okay.
Yeah.
That's interesting. And when you've mentioned that, definitely that's not how you started. There were days you'd work very odd hours, but you will tell us more about that.
Yes.
So did you envision yourself being a nurse before we even talk about the caring part of this profession?
What a great question it is. So in my childhood, I used to look forward to being a banker because I loved maths a lot. But I also was doing very well in the sciences.
Okay.
And I didn't know, those days we didn't have career development and career guide.
All right.
So you would only pick from the society what people are talking about. So what impressed me was banking. But it came to a point now when I had to diverge from what I wanted. Specifically because I didn't manage to go to Form 5 and 6. Because of my background, and that is when I delved now into healthcare. Yeah.
All right. Interesting. So it was never like you ever envisioned, you know, the way kids grow up and they know, I want to be a pilot, not because of the cliche thing of pilot, lawyer, those careers that used to be the careers.
Yes.
So you never saw it like, you never ever desired, it just happened you were good in sciences.
I loved the way healthcare workers do their job. I also liked their uniform. I liked the fact that, so when I was young, very young, I got a burn in my wound and I stayed in the hospital for some time.
All right.
So they really impressed me. But I wasn't, my heart was not in it because of the pain. The pain that I went through. But now, having grown up, I knew that as a nurse, as a doctor, as a physiotherapist, there's something positive that you can do to reduce the pain of that person. And therefore, I realized that somebody needs to be there to deal with that pain. And therefore, when I applied to go to college, because I started at diploma level, I was called for two faculties. I was called for lab medicine and I was called for nursing. And I knew there were more openings. I talked to people and I knew there were more openings in nursing because I also was very passionate. As much as I had not had anything about career development and career guidance, I was passionate about growing. So I went into nursing.
All right.
Yeah.
No regrets, I'm sure.
No regrets so far.
Okay, fine. So let's talk about the myths before we talk about the caring part. And I like the fact that you mentioned nursing to be a caring, profession. But before that part, the myths around this profession, it's very interesting that most people would actually, when you mention nurse, on many occasions, it's never, there's no mental picture of a man. It's always a lady. Have you come across that?
So for historically, I mean, starting from even when the history of nursing, it has been female dominated. And therefore, when you walk into a place and you see this big population in a hospital, you find most of them who are wearing that white uniform, which was the original uniform, were female. Right. So most people felt like nursing was for the female. But at the same time, also when you look at the definition in the dictionary, except now that it has been modified, you would see a nurse is a female. If you look at the Bible history of nursing, look at, for example, the first nurses, Pua and Shipra, they were women in Egypt. And therefore, a lot of people grew, and even today, they think nursing is female, is for female only. But may I surprise you that even in midwifery, we have male midwives, and they are doing very well. And women will come to the labor ward and say, I prefer the male. But at the same time, we also must be conscious about culture. It depends on where you are. One time I was doing some work in Garissa, and the women there, they don't like to be attended by a male. So we also have to be conscious about culture. Apart from the issue of the myth about nursing being female only, there are other myths as well. There is this myth that a nurse is a fat woman who is walking with a lot of vigor and with a domineering voice. So there are many other myths. But nursing is a profession that anybody can testify in the community, because some of us have been sick one time or another, and we've had the experience of who a nurse is. So we understand nursing better through experience and also through communicating with people. Interesting. And of course, for those that are watching, I believe you're having a deeper understanding of what nursing is all about. And especially if you want to be a nurse, or you have someone in your life that wants to be a nurse, or at one point or another, you will go to hospital, or you've been in a hospital. Now, you're a doctor in the sense of your profession, but you're also a nurse. Many times people think a nurse can never come after the title doctor. And I think that may be a bit confusing, because a nurse in the society, and I'm saying this because these are misconceptions that you're clearing for us today. People think when you're a nurse, you're lesser in terms of qualifications. So when you're a doctor, then nurse. Could you tell us a bit about that, and especially from a Kenyan perspective? So there's medical doctor who, even after attaining the first degree, they can be referred to as doctor. For us in nursing, it is not until you get to the doctorate level that you're called a doctor. So I am a doctor because I've risen to the doctoral level. At the other levels, we don't use the name doctor. So it's the doctor is philosophical, doctorate, educational level. Wow, thank you. So I'm not doing the work of a doctor. I'm still doing the work of a nurse. Yes, at that level. But you can prescribe? Can you prescribe at this level? It depends on, prescription starts quite early. For example, a midwife can prescribe even at that basic level. But now it depends on where you are and the setup. If you're in level 6, you probably will not find a nurse, level 6 hospital in the Kenyan setup, which is the highest level. You'll probably not find a nurse prescribing medication, except for certain medications. There are certain, we've classified medication, and there are some that the nurse will be able to prescribe to save life. But when you're dealing with a cold case, which is not emergency, you can always consult. But even when the doctor is prescribing, you can look at the, you have the knowledge, you can look at the prescription and tell, is this dose right? You can discuss. Remember, it's it's all multidisciplinary. You can discuss what options do we have in terms of medication.
All right.
Now, what you're thinking about, is it the best or can we modify?
Okay.
And together you gain a greater ground.
Okay.
Yeah.
That's interesting. And that brings up the aspect of teamwork.
Yes.
Yeah, because, you know, when you're treating a patient, I always see doctors consulting so that they understand something you call the diagnosis, where you're coming from and where you're going.
Yes.
Now, let's talk about the caring part, because if you went out there and did a random survey or you did your own research, you'd find very interesting experiences of patients in the hands of nurses. But I'm glad you're bringing in the aspect of caring.
Yes.
Why do you consider this a caring profession?
So caring is the core of nursing, because caring talks about the attitude.
Yes.
If I have the knowledge, if I have the skills, if I'm doing the right practice, but I'm not connecting with the patient in terms of what they are going through in regards to their emotion, their experience, the pain, the loneliness that they are going through because they are consider, for example, during COVID-19, maybe we are only allowing one visitor to come for 1 hour. So the rest of the time, the patient is away. So if I'm not able to sit there and listen and empathize with their story, this patient, even though we are giving the right medication, and at this time I want to say that health is not just about the absence of disease. It is about the wholeness of the person.
Okay.
So we get rid of the disease, but we also make sure that this patient psychologically is okay. This patient physically and socially are okay. If I have the power, even financially, if I can help them and connect them as a nurse, I make sure they are okay. So health is larger than the absence of disease. And this is where the nurse who is with the patient 24/7 comes in.
Okay.
And therefore, the caring bit is about being able to identify with the condition of the patient.
Okay.
It's actually like moving into the world of the patient and being able to tell what problems they have currently, you address them, what the potential problems are likely to be. For example, potential, I mean, this patient, for example, has been with us for 2 days. We have not seen any relative. So what will happen if we discharge him 5 days later and he doesn't have money on himself? He has the potential of being neglected in the hospital. So I address that potential. I can make a phone call, connect with the relatives and get to understand why are they not coming. And the risk, we also say there are problems, this patient is at risk of this. What do you mean, do I mean at risk of this? For example, this patient is in bed, they are not able to turn themselves. So what are they at risk of? They are at risk of lying on one side and their skin breaks and they form what we call a bed sore. So I have to know the current problems, the potential problems, and the problems the patient is at risk of, and address all of them collectively. Yes.
That's like a calling as I listen to you, and I'm just thinking, you're speaking for the many, many good nurses out there that really look at patients in a caring way. But there are times you hear stories, and people go through some very, very nasty experiences. I think the only word I can use is that. And someone is in hospital and they are treated so badly. As much as you may not speak for the ones that treat patients badly, why would someone treat a sick person in that manner?
So nursing is a profession, but at the same time, it has some calling bit about it. So it's both. And why a nurse would treat a patient badly is because they are not observing the ethical and professional code. Because there's a code in every profession. Every profession has a code. From the basic things of the practice to the most complex aspect. And therefore, this nurse who may mistreat a patient, and I know they're there and they're listening to us, it's because they are not observing the professional aspect. But even if you look at nursing as a call, because nursing is more than just a profession. Because when you look at the working hours, when you look at the stress level, when you look at the workloads, you can't pay a nurse for what they do. So it becomes more than just a profession. So whether you're looking at nursing as a profession or as a call, there is no room for mistreating a patient. And those cases are very unfortunate. And when we have a show like this one, Madam Anne, it's good we are addressing them so that our patients get to know their rights. Nobody needs to mistreat them. And also our nurses know that they should not cross the boundaries. So why would this again happen? It could be that this nurse is unwell in one way or another, mentally unstable, maybe they are too stressed, high workload, and therefore they themselves need attention.
They need attention.
They themselves need attention.
But they need to put food on the table, so they're at work.
Yes, and therefore, even for the employers who are listening to us, they need to know that a nurse is also prone to burnout, and therefore they need to keep their eyes open using the team leaders on the ground to bring out the aspect that Anne doesn't behave like this normally, but today there's something funny we have odd that we have observed, and therefore we think Anne needs special attention, and therefore the employers need to address that, and the patient needs to speak out. Speak out. Look for someone they can trust, because this is a team. It's not a one-man show. Speak out what their issues are, and they will be helped.
So that you have, so in other words, you're saying the team leader should not just be looking at how are the patients being treated, but they should look at the people that are treating these patients, how is their well-being. And I think now, because you're at the managerial level, you are able to detect that very quickly.
It's easy to detect, but sometimes it can be hidden, and that's why we talk about the multidisciplinary look. So that what I miss as a team leader, the friend can detect that and bring it out.
Great. Do you have a place for spiritual togetherness in maybe like where you practice? Do you have a place where maybe your workmates can come together by choice? Maybe to have some moments of prayer. No one is forced to attend, but at least they know there's a place we can go, fellowship, off working hours. Even though there is no really off work in a hospital, I realize that. Do you have such a place?
In the morning, every unit, every department, every ward, they choose the way they want to do it. So for most of them, they start with a prayer in the morning. So what they come and do, they receive the patient's report or the report about the unit. Then they converge together in what we call a nurse's desk. They pray, and then they analyze the report they have received. They analyze the care of the patient. And if there were issues, maybe the previous day or the plan regarding the way forward, they come and discuss it there. Apart from that, we have chapels. We have Protestant chapels. We have Catholic chapels. We also have a Muslim place where people can pick 15 minutes break, run and pray, and even this chaplain team, they come to the wards, not to minister to the staff only, but to minister to the patient and their relatives as well. So, we also have workers who are pastors, and they bring out also the service quite evidently. Now, one comment about a statement that you've said that there's not exactly an off. You can't say there's an off. Yes, there are offs. We work 40 hours a week, sometimes more. And within those 40 hours, there are breaks. There's 1 hour break. There's 30-minute break. But it's a privilege. Because you're not going to take your break when a patient is calling. Unless you have someone else to attend to that patient while you take your break.
So that means there are times you forfeit your break if there's no one, but then later if someone shows up, then you can go on your break.
You most of the times you find you forfeit your break, but you may have a working break.
All right.
Yes, you can have a working break. You're doing a few things, especially if you're doing documentation.
Yeah.
You can document as you're taking a cup of something.
Yeah.
Yeah.
And of course, in moments of emergencies, like when things do happen and there is a flow of patients, like let me take you back a bit during the time of maybe the bomb blast, for example, or something happens, unfortunately, a terror attack.
Yeah.
I don't think there's rest for people. I always see on TV, and I'm like, God, may you have mercy on these practitioners, because I don't know how they're managing at this time.
Yeah, now talking about the bomb blast, I was on duty that morning, and it occurred just before break.
Wow.
So we had not taken a cup of something.
Yeah.
And within few minutes, we had all these ambulances that came rushing in numbers. Soon the outpatient was full, the clinics were full with people, the parking lot was full with people who are wounded. Actually, in my life, I have never seen such amount of blood. So we worked throughout the day. I was in class at that time. We were just doing what we call basic life support and advanced life support session when that occurred. So I joined myself to one of the senior nurses, and we worked and worked until when I looked out through the window, it was getting dark.
Wow.
So the day was closing, and I was commuting to 60 kilometers away. So I just ran out and went to look, and I was using a matatu, public transport. I ran, and luckily I got transport and I was able to go home. But during such times, if you're not careful, you can lose yourself and you find you do not have a break. And that's why when you hear that somebody has collapsed, a healthcare worker has collapsed on duty, because they forgot themselves and they're being called here, and they're so compassionate and passionate about what they are doing. And the stomach is saying something, the mind is saying you need some rest, but they are not, what the call is stronger than what their body is speaking. And therefore, that's why we need to be each other's keeper in the healthcare field, and more so in the nursing field, where we work 24/7.
Wow.
We need to be each other's keeper. You watch over my welfare, I watch over your welfare, and I can tell you, Anne, I think you've overworked and you need to sit, even if for 15 minutes, sit and relax. Yes, think about nice things and join me in 15 minutes time.
Wow, wow. Yeah. I mean, it sounds so ideal in terms of this is how things should be. And honestly, my prayer is that this can be the practice in most of the medical facilities, you know, because that is the way things should be. But we know sometimes when you come down, like Kenyans love to say, vitu kwa ground ni different, because there are either more patients than the workers and all. And sometimes the ideal is not the reality that we face. Now, tell me, when you have done all that you know how to do, and you're caring and all, but you come across this patient that is not easy to deal with. They are upset, they are not willing to be taken care of. How do you deal with that? So if a patient is upset, or if a patient is, in quotes, a difficult patient, there's always an underlying cause. So as a nurse, if I can communicate, communication is everything, even in nursing. If I can communicate with this patient and get to find out, why are we having this? Do you want to talk to me? Even if without asking the question why, would you like to talk to me this morning? I've just come to sit here, and so that we talk. How are you doing? Is there anything you want to tell me? Communication will break those barriers, and you'll get to find out why is this patient behaving this way? Is this because they don't like the food that we are giving? Is it because they don't like the care that we are giving? Is it someone who talked to them badly and they're upset? Can my apology make a difference? And usually it makes a difference while you go to sort out things elsewhere. Or is it because they were expecting their parent to come if it's a child, and the parent did not come? Were they expecting a toy? Maybe disappointed expectations can cause a person to behave this way. Otherwise, it's not normal for a person just to become difficult
or to become upset without a reason. But remember the disease itself and the experience that they are going through can become a source of being upset.
Okay.
And therefore, if I can even give them information about how they are doing in terms of the disease, in terms of the care, and where we are heading, that gives them the way forward regarding what they are experiencing at the moment, and that opening, bringing them to become part of the care. Because I can tell them, for example, this is what we are planning, and the patient says, no, I don't want it to go that way. Is there another option? And I give them that option. They are likely to embrace what we are doing. And if that is what was causing the upsetting, they realize these people, they actually think, and they respect my opinion. And he becomes part of the care. And ideally, nursing brings in the patient. We talk about patient-centered nursing care. Bringing the patient into the plan of the care, and therefore, as they move forward together, you find by the time this patient is going home, they already understand what is expected of them when they go home. Because there are things, maybe utampatia dawa, you'll give them some medication to take home. You've been preparing them to do that. So when it comes to adherence to taking that medication, it becomes easy if you've been walking the distance with them. If they need to be coming for physiotherapy, you've already prepared them for that. And therefore, an upset patient, in fact, I read something that says there's nothing called a difficult patient or a difficult person for that matter, or a difficult leader or a difficult nurse.
It's how you handle them. Wow. We have to go on break, and honestly, you've shed a lot of light on all this nursing and what it entails. And when we come back from the break, we are going to continue talking about the life of a nurse in terms of what challenges you face. And so join us after the break and send us your feedback on Facebook Live and YouTube Live.
Faith is to be sure of the things we hope for, to be certain of the things we cannot see.
The character in the Bible who had the spirit of wisdom was the son of David, who was Solomon.
Do you know anyone in the scriptures, any character in the scriptures that operated with the gift of knowledge?
Daniel, who was able to interpret the dreams of King Nebuchadnezzar.
Yes. Can children speak in tongues?
They can.
They can.
Love does not keep a record of wrongs. Love is not happy with evil, but is happy with the truth.
Welcome to the Morning Digest, and today we are talking about nursing, a caring profession. And as we were beginning the show, our guest, Dr. Christine Musee, was able to unpack some of the myths about, nurses, and you can watch later on YouTube if you were not able to join us from the beginning. And so as we continue with the show, karibu sana, Christine, again.
Yes.
Tell us what has been one of the challenging aspects of your profession, in terms of every profession has its challenges.
Yeah.
And I like what you said, every profession has a code.
Yes.
But your profession, I think, personal opinion, might be quite something else when we talk about challenges. So maybe you can share a bit about the challenges you face in your job.
Yeah, one of the comments I want to give is that nursing is one of the largest professions in the world because it takes care of the masses.
Yeah.
If you go to any hospital, you'll find the nurses are the majority.
Yeah.
Because their working hours are also long. Subsequently, even the workloads are quite high, and therefore you find, for example, when the WHO, the World Health Organization, is talking about one nurse taking care of 6 patients, you go to a setup where you find that there's only one nurse in a healthcare center, for example, to take care of everyone. Or you go to a ward and you find that you're having 2 nurses and you're having 100 patients, or you're having 60 patients or 40. That means a nurse is taking care of between 20 and 50 patients, depending on what your setup is.
Wow.
Now, this becomes quite a problem when the patients are acutely sick.
Yeah.
They hardly do anything for themselves.
Yeah.
It becomes quite a workload. But even when the patients are mobile, you will realize that that number is still quite high. So the workload is high, and a nurse is forced to be quicker, to be a quick time manager, a good planner, identify priorities quickly and address the acute priorities in good time before the patient's condition worsens. The other challenge we have had as nursing, as a caring profession, is the introduction of technology. A caring profession means that you're not very distant from the patient. Because you remember, technology takes care of the physical aspect. It also takes care of the physiological aspect. But nursing will take care of the social aspect, will take care of the spiritual aspect, and the psychological and emotional aspect. And the technology cannot do that. So when technology has come back, it's kind of pushing the nurse far from the patient, so that the things that the nurse used to do will be done by technology.
Allow me maybe to interrupt you.
Yes.
When you say technology taking the role of the nurse, what exactly? Maybe you can give us one example.
There are some procedures that the nurse needed to do with his own with our own hands, his own hands as well.
Yes.
But now you can use a machine to do that.
Yeah.
For example, turning patients. You turn patients using your hands, meaning you must draw close to the patient and turn them. But today we have machines that can lift and turn patients.
Wow.
That means the contact period between the nurse and the patient has been lessened. It's a good thing to use those technologies because they also save the back of the patient, of the nurse, so that she's not having back problems and too much fatigue. But it is drawing the caring aspect of the nurse away.
The human touch.
Yes, the human touch is being drawn far away. But of course, today there are things that you can still not do with technology. So as much as technology is good, there's something that is coming in as a challenge. It's also coming in as a challenge because most of us were not technology savvy, and therefore it's quite a challenge to adjust now from what we were used to what is. Yes.
You want to say something?
Yes. I'm trying to pick the other.
It's fine. If you remember, later
if I remember,
we will continue
I'll say
on that one. No problem.
Yes, thank you.
Now, you mentioned something about priorities versus giving good delivery. In terms of when you have to choose a priority versus excellence. In this sense, you have 100 patients. You have to check their essentials, or maybe let's make it 40. Because 100, honestly,
100 are many.
There are many.
It could be 30.
30, 40. And according to what you say, the standard should be 6 to 1 nurse?
6 patients to 1 nurse. In the general ward, 1 to 1 or 1 to 2 in the private, ICU.
In the ICU. So when sometimes you have to choose between priority and excellence, especially in the public, or even you can speak across the board, because you've probably dealt with both sides. How can one choose between excellence, serving clients well? I'll break the question to an easier perspective. You have someone who has come, they're a bit sick than the others who've been there, but the others are also sick, and they will not feel good when this one jumps the queue. What do you do?
So in the hospital, we have triage, if it is in the accident and emergency outpatient place, where we must identify those who are critically sick, and regardless of whether they came as number 30, they move and become number 1 if their care is needed now to save life. As you're doing that, you're also talking to the other patients that this one needs my urgent attention now, so that they don't begin to complain. So the communication bit also comes there. So prioritization can be done using triaging process. There's also what we call the ABCDs of life.
All right.
They are used partly also in that triaging, but they are also used in resuscitation when you're resuscitating a patient. So A is airway. You want to check, is the airway okay? Because airway is where we breathe through. If I have something in my mouth and my airway is blocked, I will not be able to breathe. Then survive. B is breathing. How is my breathing? Is it 18, 16, 14, the expected normal of an adult? Or is it lower, or is it higher? Then I want to look at my C. My C is cardiac circulation. How is my heart beating in the first place? And if it is beating, how is my pulse? I check the pulse, the strength, the regularity, and the quality of that. Then I move to D. D can be disability. D could be, does this patient need to be given drugs? Then I can even move to A. I expose the patient and look at them from head to toe, because I have already taken care of the A, the B, the C, and the D. Now I can take care of E. If there's a problem in A, I cannot move to B until I have taken care of the problem in A. So once I'm happy with the A, now I can move to B. I tackle the issues in B. If I'm happy with the B, I move to C. I cannot move to C unless I've taken care of A and B. And that is how we set priorities. And then one other thing that is an emergency is chest pain. Whether the A is good, the B is good, and the circulation feels good, but the person has chest pain, that's an emergency. We must attend to it as soon as now.
All right.
Yes.
Wow, that's interesting. And as you have been talking about A, B, C, and D, you're teaching us a lot, especially on matters of nursing and how to react to patients, until sometimes you're like, maybe I should have been a nurse. But anyway, I have my field where God called me into. Now tell us, how can a nurse make a patient's life better in terms of the people have various experiences, and on Facebook, in fact, Karen is saying sometimes nurses are probably nasty because they have burnout. It's triggering burnout in them, or for them it's a call or a job. That's a comment that she gave on the same. And it's true. You've told us that for some people it's not a call. And so how can a nurse make the experience of a patient memorable in this sense? I come to hospital, I'm sick. I don't need a nurse to make my life more miserable, because I'm dealing with the pain of the body. How can a nurse?
Yes. So today we are looking at caring.
Yes.
There is no caring unless it comes from within the person. I can only give what I have. And therefore, the way I think about myself is what I'm going to do to other people. So first of all, I need to be self-aware. What are my strengths and what are my weaknesses? Yes, I have these strengths. Are they useful to the patient? I have these weaknesses. Are they going to display themselves when I'm doing nursing care? Is there something that I can do to address my weaknesses, either to submerge them under the water, or I train myself new skills that are going to address the needs of the patient? And therefore, I said from the beginning, for me, nursing is both a profession and a calling, because you can never pay a nurse enough. And that's where the calling bit comes in. And that's where servanthood now comes in. If you're a leader and you're a nurse, unless you embrace servant leadership, you can never get anywhere. And a servant is the one who gives their life to serve colleagues and to serve patients, but also you take care of yourself. Because if you die from burnout, that patient will have no nurse tomorrow.
And many other patients.
Yes. So as I'm doing self-aware, I need to know, normally I'm an energetic person. But pale nimefika sasa, where I've reached now, I think I need to give attention to myself. It's been a problem for me for a long time.
Are you speaking like for real, like right now you need attention?
No, it's been a problem in my nursing care to drop what I'm doing to take care of myself. But I've reached a point where I've realized I'm only as good as I'm alive. When I'm away,
healthy. It's true.
When I'm
It's
away,
true.
this patient will suffer more.
That's actually a very strong point, because you being sick means many more people get to suffer. So you need to take care of yourself.
True.
Interesting. So tell us about, you know, dealing with people's lives is a very spiritual affair, and we cannot ignore that. I was listening to someone that said that there are several doorways into people's lives. One is a school. The teacher that comes into contact with a child determines the outcome of this child. Some teachers destroy kids' lives by the words of their mouths. Now, a hospital is another place where people's lives are, it's like a gateway to people's lives. So what is the role of spirituality in medical practice?
One day I received a patient who had been burned from head to toe, a young lady newly married. And as I spoke to her and as I attended to her, I was persuaded to ask her, are you born again? She told me she wasn't born again, but she knows she has been preached to, and to her it wasn't a priority. And I asked her, do you want to get born again? She said, yes, I want to get born again. Pray for me, and pray for me to get healed. Of course, I prayed, led her to Christ, and I prayed that for her to get healed, even though I knew what her prognosis was. As she was prognosis, is
for the
capacity to heal or not to heal, the chances,
the result.
The chances to recover. The chances for her to recover were low in terms of medicine. So as we continued to take care of her, of course, she deteriorated. She had already received Christ Jesus. I remember one thing vividly about her when she was about to die. She said, Jesus is pouring his blood on me. And this blood is quite warm. So that's one of the examples that I tell people, that the blood of Jesus is so real. Salvation is so real. She could see Jesus pouring his blood on him, and it's very warm. And she died as a Christian. So the doorway, the role of spirituality in nursing is evident. It's so crucial that it cannot be ignored. We do not talk about being healthy if the person is not spiritually well. In terms of professionalism, we say do not impose your religion on someone. For me, as me, I always talk to people about Christ Jesus. Every opportunity I get, even the person who dropped me here this morning, I spoke to them about Christianity. And they told me how they were about to commit suicide at one time, but they received Jesus, and those thoughts have gone. And therefore, it's an opportunity for me to talk to them. I'm not forcing it down their throat. It's a choice they are making.
You're the messenger.
And therefore, if this patient is going to be healthy, the word of God, Jesus Christ, must be introduced to them. I mean, for me, it's Jesus Christ. I talk to them about it, and I don't force them to do anything.
Unapologetically.
But even when they say no on day one, I still will revisit the story later. And you'll be surprised how many people get born again in the hospital. How many people get born again when they are unwell or when they are in trouble. And you know, they don't do it just because they are in trouble, but it's because they are able to stay still in one place and listen. The other time when they were so busy, they didn't have time. They were busy doing their own things. But in this confinement, they are able to listen. And therefore, spirituality is critical.
Real. Thank you. I mean, the fact that, you know, spirituality is real means we should pray that more and more of the medical practitioners may not just be messengers of healing the physical body, but they can also be servants of God serving in the medical profession. Because that way they get to usher people into physical health and eternal life. Because the Bible says after you gain everything, what shall it profit a man if he gains the whole world and loses his soul? So tell us about, are there times you have faced conflicts at work? And I know conflicts between workers in a medical profession can jeopardize a patient's life. How do you handle that when you called it prognosis and diagnosis? One is saying this, the other one is saying this, there is a life at stake. How do you deal with that?
So there are different levels of conflicts, and they are our daily food. We meet them every day. And one of the aspects about nursing as a caring profession is that there needs to be critical thinking, which teaches us to recognize problems like conflict and address it promptly, as opposed to avoidance, burying things under the carpet, and things get worse and worse. So whatever level of conflict, we seek to address it as quickly as now, so that, because the multidisciplinary team role and synergy is important at every level. I need your little input, I need that man's much input, and together it will make the whole that will make the patient well. And therefore, even though conflicts are continuous, whether it is because of professional knowledge, or whether it is because of personal differences, or because of an issue I had at home and I carried it to the workplace, and therefore I'm at age, we seek to address them immediately. And that's why the eyes of the team leader, the eyes of the team players, the eyes of every person need to be alert to recognize it in good time and address it so that patient care is not compromised.
I think that's very important, because what I'm getting from you is if there's anybody that needs to be sober, is anyone that walks into a ward full of sick people, sick children, and these people are dependent on God first, of course, if they believe in him, but above all, they're dependent on the person who walks into that ward. The state of mind is very, very key. There's something you mentioned about your previous, a patient you dealt with, and you led them to the Lord, and it made me think of what goes through a practitioner's mind, a doctor, a nurse, when they lose someone they have been working with. I think that is something even generally in life I have struggled with. And maybe that is one of the things that never allowed me to become a nurse or a doctor, because I think I would need to go for therapy every time I lose a patient. So you know where I stand with that. So how do you deal with loss of a patient, someone you have been praying for, treating, and hoping for the best?
So one of the qualities of a nurse is empathy, as opposed to sympathy. So empathy, you walk into the world of the patient, but you're not necessarily affected in terms of your practice, in terms of your daily activities, by what is going on in the world of the patient. It is a very thin line. Empathy and sympathy, it's a very thin line. And personally, I've also struggled to put that demarcation. But I have to keep reminding myself, you're supposed to be empathetic and not sympathetic. What does this mean? This means if a child collapses, I don't start crying. I start giving life support to that child. I don't scream. I'll give you an example. At one time, I was living in a plot, and my neighbor's child was about 1 year old. And he stood on a chair, and there was a bucket that the house girl was mopping with. And of course, when he looked into the water, he must have seen his face or something. And he decided to play with his child. So his head went into the water, and he collapsed. God is so gracious. The mom came in good time to find the baby was not dead, but the baby was what we call limp and responsive. And from my house, I heard a scream. She screamed, and she was holding the baby upside down and trying to remove the water from the abdomen. Of course, at those days, she was bigger than me. God graciously caused her to fall, and she let lose the baby. I received the baby. I had just done basic life support and advanced life support. And those days we were not afraid of mouth to mouth. I did that. I did what we call cardiac massage. And within a few minutes, the baby opened his eyes and he was breathing stably. He had a pulse, and we were able to take him to the hospital. And today he's in the college. Thank God. So that's the difference between empathy and sympathy. The mom was sympathizing. I was empathizing. So if you can put a demarcation between the two, then you're able to survive. If you don't, you'll be exposed to all these stresses that go with sympathy. And
I'm getting the difference loud and clear. And now you understand why some people cannot be nurses, because I think they'll be sympathizing so much that patients die.
You learn with time.
You learn with time, because I'm just thinking, I mean, someone is sick and you have to do this procedure that requires the patients to be in more pain, but it will save them. So wow, thank you for bringing that out. What has brought you the greatest satisfaction as a medical practitioner at a personal level?
At this time, I would like to say what has given me the greatest joy is to learn that I do not need a title to be a leader. When I'm a basic nurse, I can lead at that level by giving excellent nursing bedside care. When I grow up and I join, for example, research, which is my passion today, I do it passionately and become out as a leader. If I'm doing a great or a small job, it doesn't matter what you call me, whether you call me doctor or you call me matron or nurse or whatever. Sometimes we are even called sister, which is still okay. It doesn't matter what title I'm given. My passion is I do what I do to the best of my ability through the grace of God, because I'm a born-again Christian. And that has given me satisfaction, and keeps me driving. Even when there's mockery, it doesn't put me down. I always remember you're here because God has put you here, and there's a name he calls you by. It's not the name that you're called at this level. There's a name that God knows you by, and you better move by that name, that title.
Wow, thank you. You don't need a title to be a leader. You can lead at the level you're at, even at the bedside level. You treat the patients so well that they don't even miss to see a consultant. Of course, you're a consultant in your own right, but I get the point, and I believe the viewer that's watching, in whatever profession you're in, you do not need a title to lead. And of course, the titles can come later. Just to, acknowledge the people that are watching, Felista Peter is in agreement with us, saying, doing what you do to the best of your ability. Liz Mwende says, no need for titles to give care, do what is expected of you, and exercise professionalism. Thank you so much for your comments. And someone else here, Mary Gonke, said you do not need a leader. She's agreeing with you. You don't need a title to be a leader. Thank you so much for the comments that you are making. As we bring this to a close, we need your parting shot, please. There are people that aspire to be nurses, but they're afraid of blood. They're afraid of the pain. They're afraid of experiencing the journey with a patient. Maybe you need to speak to those people and encourage them.
Okay, so I'll just speak as it comes. One of the first things that I want to say is you as a nurse are professional. You're professionally commissioned. You're commissioned and you're a professional. Never let that go out of you. Now, for all of you who are not nurses and aspiring to be nurses, nursing is one of the satisfying professions that you can get into when you look at that person who is coming in unwell and they are going home well. And also when you're looking at people who have been in pain as they are coming in and they are not in pain in the next 30 minutes because it's something that you did. Not necessarily giving a medication, but you gave them caring talk, a caring presence. That makes all the difference. Now, for those of you who are not nurses and will never become nurses, but at one time you will need the care of a nurse, I want to let you know that a nurse is a professional. They are quite knowledgeable and they are compassionate and they will understand you. Speak to them. They have enough knowledge that they can give to you regarding the condition that you're suffering from or your loved one is suffering from. And for those of you who are employers of these nurses, please support them and promote them as necessary. Avoid oppression, avoid burnout where it is possible, and support them in every way. Because customer satisfaction is pivoted on the kind of nursing care that is given in your institution. Thank you very much.
Wow, thank you so much. What a parting shot. I'll ask you one last personal question.
Yeah.
If you were not a nurse and you were not a banker, what would you have become?
If I was not a nurse and I was not a banker.
Because your initial career was, I want to go into banking, this didn't work out.
Yes. Like I said from the beginning, Madam Anne, whatsoever God has put in my hand.
Yes.
At one time I was making curtains.
Wow.
I always do it to my best.
Wow.
Whatever God puts in my hand, I always put my best foot forward. At one time I was hawking.
Yes.
And I was doing it thoroughly, hawking.
Yes.
Yes, and paying school fees for people and doing. At one time I was knitting, using hands. So my life is open, and it is open to my maker, God. Yeah. As much as I wanted to go banking, when I got born again, which was much later in life, I let my life open to God. Amen. and asked God to drive it. And therefore...
I got your point. Excellence. In other words, excelling in all that you put your hand to do.
As the Lord helps
My motto in life is always, show me a man who is good, excellent at what they do, and I will show you a man or a woman that will stand before kings and not mere men. May God cause you to stand before kings, even in your health practicing. Thank you so much, my dear viewer, from wherever you are watching us from today. Our guest has been Dr. Christine Musee, a professional nurse in the caring nursing profession. Until we meet again, may the Lord bless you, may the Lord keep you, and may He cause His face to shine upon you. Amen. God bless you.